Let me go over this one here. Now, tell us a little bit about this.
Well, this is another gangrenous lesion that is on the leg of a patient, and most likely they probably had an ulcer or an injury, like our previous caller mentioned, that didn't have adequate circulation for healing and probably developed necrotic areas within the wound.
So are you? So this here, because it's darker here, is it?
Yes, this area here is necrotic, and that's dead tissue.
Mm-hmm.
Also, probably some of this in this white area is probably necrotic and dead tissue, as well as this gray area here.
And that's because of no circulation.
Because of poor circulation.
Poor circulation.
Mm-hmm.
Wow. Now, I know that one of the other things, I want to share this because this is really important. If you can explain this here a little bit. Now, I know this is of an actual case, so you can talk a little bit about that as well. Showing the differences.
Yes, I spoke of earlier how we can salvage or save a leg,
Mm-hmm.
and this is a patient that had a clot that developed in their leg, and they had blockages. That's where these arrows are showing there was blockage. This is a picture of the arteries in the legs.
It's much
and
lighter.
You can see down here at the bottom that it's much lighter, and
Mm-hmm.
that the lower portion of the arteries is not as dark on the image. And then to the right is an image of the arteries after they have been opened, and you can see that it's much darker here, and also distally
Mm-hmm.
that the arteries are more visible and darker in the image after the clot has been removed.
So you've got the blood is now flowing.
The blood is now flowing.
Wow. It's
Yes.
I know as we're out in community and as we continuously, because we do thousands of glucose screenings, and we see all the time in community individuals who have wounds that don't heal, that have a cut that's been there for months and changing or infected and it doesn't go away. And these are signs that can eventually turn to something very, very serious.
Yes, they are, and I encourage people who have those types of wounds to seek further treatment.
Mm-hmm.
They can go to their doctor, and they can ask to be sent to a wound center like we have at Masonic
Right.
Hospital.
And this oxygen therapy, it's unbelievable what it does.
Yes, it is. It's amazing because a lot of times we can save tissue that would not be salvageable if we didn't have it, because it helps to deliver a high concentration of oxygen in the area of the wound or in the area where there was ischemia or lack of circulation before. And it actually helps to reestablish circulation where there
Right.
wasn't circulation before.
So the cure that there was in 5, 10, maybe, I don't know, 15 years ago, how long has this been out?
Oh,
probably been out for a while, but
hyperbarics has been in use for a very long time, for tens of years.
It's just it's not, a lot of people don't know about it.
They don't know about it.
And that's why we're here today to talk about some of these
right.
things.
The Navy was using hyperbarics like way back
which
when.
was not available to the general public as we have now.
Exactly.
And it's available to everyone and anyone who needs this type of care. Now, Dr. Satcher, I know that you can actually, you're at Advocate Illinois Masonic there at the Hyperbaric Wound Care Resource Center with Dr. DiMaria at Illinois Masonic. And if they have any questions or want to schedule an appointment or just see someone regarding it might be a problem or an issue, they can reach you at 296-8360 or 60. Again, that number is 296-8360 at 773 area code at Advocate Illinois Masonic. I do want to talk a little bit about what are some of the risk factors of PAD.
Some of the risk factors that are very important are, for instance, diabetes, because it can increase the risk of peripheral artery disease by 3 or 4 times that of the normal population, which is pretty impressive. And a third of the patients that have diabetes will develop ulcers and wounds in their lifetime. So that's a very important risk factor.
Now, I'm sorry. I don't mean to interrupt. It's just this is very interesting. But only because we see so many people in community when we're doing health fairs when we're out there, is that you see a lot of individuals with what looks like a burn blister, water blister, and not realizing that can really be infected. It's a wound. It can be infected very quickly once it pops.
Yes, and they should like I said, talk to their primary care doctor and get referred to a wound center.
Do not ignore it.
Do not ignore it. Do not put, another thing that people like to do is put home remedies on wounds. We see that a lot. People are rubbing aspirin or butter or different salves and ointments onto their wounds, and they're diabetic, and it just makes a big mess.
You know, I've actually had a lady not too long ago who actually told me, she says, I don't know how I got burned, but I've got this blister, and it doesn't go away, but I don't remember getting burned.
Yes, and that happens quite frequently with diabetics because they don't have the nerve sensation. They have neuropathy in their hands and feet frequently, and it's very important actually that they have their feet inspected.
Right.
If they can't see the bottom of their feet themselves, they should use a mirror or have another family member look at the bottom of their feet every day, check between the toes, wash your feet with soap and water and dry between the toes, and just make sure that a wound has not happened there that they are not noticing.
So Dr. Satcher, how can PAD be prevented? Or can it be prevented?
Well, it can be prevented by addressing some of the risk factors. I didn't talk about the other risk factors, actually, which are hypertension or high blood pressure. High cholesterol is another risk factor. And so that if they have those diseases aggressively addressed by their primary care physician, then that lessens the likelihood that they will develop peripheral artery disease. If they are diabetic, they need to have tight control of their diabetes. They need to keep their blood sugars below 120. They need to exercise regularly. If they're overweight, they need to lose weight.
So diabetes is an epidemic, and it's something that we can control, something we can prevent, and something we can maintain. So, doctor, when should a patient go to the wound center? If it's become to this point, when should they go to the wound center?
Well,
avoid going to the wound center, which is the better question.
We want them to come.
Obviously. Well, you want them to get their care, obviously.
Right.
Absolutely.
Even if a person is not sure, we're happy to evaluate them and to help with the decision making. But they should talk to their primary care doctor. If they have a wound that hasn't healed, if they're diabetic, they probably need to get immediately referred to a wound care center, because often diabetics, the wound care management is complicated in diabetics, and they tend not to heal for various reasons. But if you have a wound and it's been going on for 2 or 3 weeks and it hasn't healed, then you should get a referral to a wound care center.
And as a diabetic, they should annually get their feet checked by their podiatrist. Go to a podiatrist annually and get their feet checked.
Yes.
Well, Dr. Satcher, I can't thank you enough. Our time goes by so fast
here,
and we can continue to talk and talk, but our time is limited. So to our viewers, for all of those of you who are at risk, please see your doctor. And again, if you need any assistance, you can always call Advocate Illinois Masonic Hospital, our physician services, Dr. DiMaria at the Wound Care Center, or Dr. Serena Satcher. So I want to thank you for coming out again and sharing this wonderful information that obviously we never have enough time to discuss even further. So on behalf of Advocate Illinois Masonic Hospital, Gottlieb Memorial Hospital, our affiliate, and Hispano Care and the staff, thank you for tuning in. So until next time, we'll see you soon. Take care. Bye-bye.